Good afternoon, everyone.
Good afternoon.
My name is Tanisha Lyons, and I'm an administrative assistant here at the health department. So we just want to welcome everyone to the 80th celebration of the health department. And so we do have a small program that we're going to start off with, and then we'll have a tour of the health department. So we will have greetings by our health director, Dr. Margaret Brake.
Good afternoon, everyone.
Good afternoon.
I would like to welcome you to the Warren County Health Department's 80th anniversary celebration. We are elated that you have come to share in this celebration. It is truly a blessing and an honor for me to serve as health director for Warren County. It is an enormous responsibility to shoulder the health of an entire community, but we do so with dedication and a commitment to improving the public's health. Three major roles of public health are to protect the public from outbreaks, illness, and disease. We all just went through that with COVID. We also prevent disease through education and by assuring access to health care. And finally, we promote healthy lifestyles through education and policies. I want to thank you all for sharing in this work because much of our success is driven by the wonderful partnerships we have with many of you who are in this room today. I would also like to acknowledge our Board of Health members who are here. If you don't mind standing or at least raising your hand. Dr. Elton Brown is our board chair. We also have Ms. Candace White, Commissioner Baker, Ms. Kay Hall, Ms. Eva Brown. Thank you all for being here, and thank you for all the support that you give to the health department. It means so much to us. I just want to say to you all to please enjoy the reception, and please take the tour. I would like for you to meet our staff, learn more about our services, and pick up some goodies along the way. So they do have some trinkets. So thank you all for coming. I really appreciate your being here.
Now we are honored to have our county manager, Ms. Crystal Smith, to give us some words. Let's give her applause.
I'm gonna see who's behind me, and then they'll drive the next one here. Okay, Angelina. Yes, you're not on the list, but I was checking to see. Good afternoon, everyone. My name is Crystal Smith, county manager. I've been a county manager for almost a year, but I've been with Warren County since 1996. So throughout my career in Warren County, one of my biggest partners was Warren County Health Department. Through North Carolina Clark Extension, our biggest program area is health and nutrition, and who did I depend on? The health department. And moving forward to COVID, who did I depend on to make sure I was safe? Was the health department. So as I think back, not just since 1996, but researching what has happened since 1945, a lot of great things have happened. And who was the pillar, the core of the happenings was Warren County Health Department. So I say to Warren County Health Department, to the staff from the past, Karen, and to the future, thank you for the work that you do here for Warren County and the citizens and the neighbors, because sometimes I'm one or the other, Franklin or Warren, depending on the day of the week. So I say to you all, thank you all for coming to support us, and I want to recognize our county commissioners who are here because we're one. Our chair, Commissioner Ms. Baker, and those who are not here, just know they are here because they do support us. So again, on behalf of Warren County government, thank you all, and thank you Warren County Health Department and your team for making it work here in Warren County. So thank you.
Thank you, Crystal, for such kind words. Now we will have a historical overview from Ms. Kay Hall. She's our retired nursing director and also serves on our Board of Health. Let's receive her.
Tanisha, I would not answer the phone when she called anymore. Because this is not my thing. I retired with 25 years of service from the health department, almost 5 years ago. But when I started as a public health trainee, public health nurse trainee, because I did not have a full year's service. At that time, we all had to take courses for intro to public health nursing, so things have really changed since I came to work. Mine happened to be we had to go to Chapel Hill 1 day a week for 12 weeks to take the course. But when I came here, we shared this building with Warren Health Clinic. We shared the building, they were down that hallway, we were down the hallway environmental health is in now, and we shared the lab at the time until they left and we took over their clinic hallway. But we had, I think, I was trying to count it up when I came to work, I think we had between home health and the clinic, we had like 20 nurses. And our social workers and aides, environmental health staff was in another building at the time, but still part of us. But back then, our clients would come in, and it was before HIPAA. So they actually would carry their charts. There's not a lot of us here that still remember this. But they would bring their charts to the back and put them in the box where we had them waiting. And if they decided they were sitting out here too long, you would find them back in the back again, rearranging the charts. So they were trying to put themselves first. So you had to constantly look at our handwritten list because we didn't have electronic health records at the time. But we also did a lot of things for our clients. If they couldn't come to us, we went to them. Immunizations, social work visits. If we had to, we'd go pick them up and bring them to their clinic visits. And of course, this was all before HIPAA went along. We'd bring them in for the clinic, for their WIC, whatever they needed. But there were very few doctors that accepted Medicaid, so we were the place to be. We were very busy. We had child health clinic 2 days a week. One of those days, we had Duke pediatricians who came and ran clinic for us. Our family plan and maternal health has Duke physicians and still do. So this was a very busy place, but one of our most fun events, and I shouldn't say that with flu season, but we talk about it often, we would have flu shot Sunday. And that was, we would be here, we would have refreshments set up. People would come when they left church, they would come out of the health department to get their flu shots. Or they would go eat Sunday lunch and then they would come to the health department and they would stay out here and visit and have the best time seeing each other. And we would give, 200, 300 shots a Sunday afternoon. And it was fun for us, watching all those people seeing somebody they might not have seen since last year when they came for flu shot Sunday. And then, of course, there was the H1N1 incident where our vaccines ran short, and we had people lined up around the building. We had people getting here at 4:30 and 5 in the morning so they could be first in line. And after 9/11 hit, preparedness and Homeland Security kicked in, we got notified that we were gonna get a shipment of medicine. And at that time, there had to be someone here to receive it. A law enforcement agency vehicle had to be parked in the front parking lot or the truck would not stop. And the truck was escorted by a highway patrolman. So our health director at the time, myself, and I believe Cheryl Kaufman came over here and sat with us. They got lost some way coming to Warrenton, so it was 1 o'clock in the morning when they showed up. And they would not unload the truck unless the law enforcement was here, so Warrenton's chief of police was sitting out there with us. We had no idea what to expect, didn't know how big a shipment it was. And they got off maybe 4 or 5 boxes, about like this, off the truck and brought them in. And the truck driver was like, I don't know what I'm hauling, but it must be important. Well, what it was, we all now know Tamiflu. And what it turned out to be was a statewide preparedness exercise. They didn't tell us that at first, so we had no idea what we were expecting. Our home health agency has always been a big part of the health department. We at one time had PT, skilled nurse, and OT speech, and we just all worked together to do whatever needed to be done. And I can say that when you work at the same place for 25 years, and you come in this same building day after day, you see many changes, and you see some staff come and public health just hits and it's their thing. And some of them say, no, it's not a good fit, and they leave. But through it all, you become a family. You work together, you help each other, you support each other, good times or bad. And they've all meant the world to me the whole time, from trainee to nursing director to now board of health. And I can honestly say that I enjoyed most days of all those days coming to work. Thank you.
Wow, thank you, Ms. Kay. You gave a lot of information that I didn't even know had heard of before. Wow, that was deep. Getting
Well,
lost.
one day I'll tell you the rest.
Okay. I'll call you tonight and get some more information. So we're going to ask about incoming visitors. If you could just please come and take a seat, if some of our staff would be willing to give up a seat so our guests could. I'm sorry, staff. Yeah, if our staff. Thank you. Paul, anyone have a seat? April?
Sit next to one.
Thank you again, Ms. Kay. So now we will have recognition of our staff by Dr. Brake, and then followed by that, we will have remarks given by Dr. Elton Brown, our Warren County Board of Health Chair. Thank you.
The mission of the Warren County Health Department is to provide services to improve the health of Warren County citizens. How we fulfill this mission is through the work of our awesome staff and community partners. So at this time, I would like to introduce our leadership team, if they would come up front. Winona Mills is our nursing director. Rhonda Mushaw, health education supervisor. Ashley Evans, our women, infants, and children, which we call WIC. Catherine Mendez, environmental health supervisor. Susan Wells, nurse supervisor. And we have one person that's missing, that's Miss Andrea Good. She's our administrative officer. So we have a great work together awesomely, and are just great leaders. So thank you all. At this time, I want to introduce our different divisions within the health department, and hopefully when you go on your tour, you'll learn more about them and some of the work that they do. I would first like to have the finance and administration unit to come forward. And this team is supervised by Andrea Good. This is our finance, our administrative report, answering the phone and watching the doors. So, our WIC division.
Where did they go? They're in front of you. And I think some of our administrative staff came out. Nydia,
is our part-time IT. And these are the ladies that mostly greet our patients when they come. Okay, clinical services. Clinical services.
Oh, here we are.
This team actually includes our nurses, our lab manager, and we also have 2 social workers.
Whoop, whoop.
Off the sticker. Okay, next we have environmental health. This young lady is Penelope. She is actually an intern from New York. And she has been with us since early July? Early May. Oh, yes, early May. And so she actually has been working on a special project, and so we are excited to have her and have her present to our staff about her work. But we're really excited to have her. She's our first intern from the National Environmental Health Public Health Association.
Awesome.
And last but not least is home health. And so we do have, actually we have a new person starting on Friday. So we have our, a home health supervisor position that we just recently filled, and she will start on Friday. So we're trying to get our team back. I will say COVID hurt us in a lot of ways, and staffing was one of them. So with home health, we had a lot of federal mandates, and one of them was you had to be vaccinated and all those kinds of things. So COVID hurt us with staffing, but we're trying to build back up, so we're excited to have Ms. Darlene. She's on contract with us. And as I said, we'll have a new person starting on Friday. Thank you. Okay, and I did I said last but not least, but this is really last but not least. And this is the health education team. So they're kind of like the backbone of the health department, because a lot of the community work you see comes out of this unit. So this is our health education team.
All right.
So I just want to take this opportunity in front of you all to just say thank you to our staff. They do whatever I ask them to do, and I really appreciate that, because sometimes it's a lot. There's a lot going on, and I know I ask a lot of them, but they don't ever fail me. And for that, I am very proud that they're on my team. So thank you guys. I love you. I appreciate you so much.
Dr. Brown?
First of all, Tanisha called and asked me to speak, but she didn't tell me what to speak about. So the rest of them, they all know what they're supposed to say. Number one, thanks for the staff and the board members that are here. The support that they give us is fantastic. Members of the public, glad that you're here. I want to give a little bit of history as well. I've been on the board about 12 years, been the chairman the last several. But I had the privilege to be on the committee that selected Dr. Brake. I was impressed with her resume at the time, have been super impressed with her job over the years. It's a great asset for this county and this community, and we need to support her any way we can. So, thanks for being here, board members especially.
Thank you, Dr. Brown. Well, we're almost near the end of our ceremony here. So now we will have the reception and tour. So what we're gonna do is gonna break you down in I think 3 groups. We have 3 tour guides, Deidre Merrow, Karen Prince. And Haley Painter. So we're gonna break up these 3 groups, and they will take you into the different areas of the health department to just show you and be able to speak to some programs and their coordinators and the services that we offer to our public. Okay?